In a patient who has undergone aortic valve replacement, AVR with the Perimount Magna Ease valve, and mitral valve replacement, MVR with the St. Jude Epic tissue valve, echocardiography reveals that the prosthetic valves are working as expected. The Perimount Magna Ease aortic valve, comprised of bovine pericardium, supported by a flexible cobalt-chromium stent, opens fully during systole and closes completely during diastole, preventing any regurgitation. Doppler imaging shows no significant aortic stenosis or regurgitation. The St. Jude Epic mitral valve, made of bovine pericardium mounted on a titanium alloy stent, also functions well with smooth flow, a normal peak diastolic velocity, and mean gradient. A trivial amount of regurgitation is noted, but this is not clinically significant. However, despite the normal functioning of the prosthetic valves,
the patient still faces significant
cardiac challenges.
Echocardiography reveals a dilated left ventricle and a severely reduced ejection fraction of 25%,
indicating severe systolic dysfunction. This is likely attributed to chronic volume overload from the previous severe aortic and mitral regurgitation, worsened by underlying coronary artery disease (CAD). Unfortunately, the presence of these factors complicates the patient's prognosis and places them at a high risk for heart failure progression, arrhythmias, and sudden cardiac death. To manage this complex situation, the patient requires diligent monitoring and comprehensive care. Regular echocardiographic follow-up is necessary to assess the function of the prosthetic valves and the size of the left ventricle. Heart failure management may involve the use of diuretics, ACE inhibitors or ARBs, and beta blockers. It is also crucial to aggressively address the CAD through methods such as antiplatelet therapy, statins, and lifestyle modifications. Given the reduced ejection fraction, consideration should be given to implanting an implantable cardioverter defibrillator (ICD) to mitigate the risk of sudden cardiac death. Overall, although the prosthetic aortic and mitral valves are performing well, the patient's condition is still worrisome due to the dilated left ventricle, reduced ejection fraction, and CAD. Consequently, the prognosis remains guarded, and ongoing management and follow-up are paramount to ensure the best possible outcome for the patient